Hi, I'm Ray Sievert with Tracy Technologies. Today we're going to take a look at a Toric Surprise and try to walk through a case presentation of how this problem happened and how to fix it. So let's take a look. What do we have? We have a patient with a pretty good cornea, although that looks a little odd. When you look at it, that hot spot's 47. There's a hot spot up here, 46.25. So it doesn't really look like keratoconus. It just looks a little odd, but we'll keep an eye on that. The problem is that our vision's not perfect here. It's a little blurry here, but the problem is refractively we have 2 diopters of astigmatism after implanting a toric. So you know what to do now, right? We go to toric check. The toric check says that the lens is sitting at 47 degrees and it should be at 26. The power is 322. It should be 289. Close enough. So when you look at this 18-degree rotation, you're going to end up with an excellent result. But now here's the twist, if you will. The doctor says that lens needs to be at 43. It's only off 4 degrees. Your machine is wrong. It shouldn't be 26. I put it right where I wanted. Well, let me ask you the question then, doctor. Is the patient happy? No, they're not. How did this happen? Well, it goes back to a little bit of learning a little bit more about Ks. When you look at the K readings here, the keratometry, what do you have? You have refractive Ks, which we recommend are much better than sim Ks, saying you should put a 278. Sim Ks say put a 322. But where? At 43 degrees. So you can see some of these simulated keratometry would say, this is how much you need, this is where you need it, and that's exactly what the doctor did, but didn't end up with a good result. We're saying that you should use less cylinder and at a different location. Let's look at this. In the center ring, you have an axis here that's closer to 28 and an axis here that's closer to 43. Well, how about that? Let's go back and look at our patient, if you will, on the toric check. When you look at this astigmatism, they have a small pupil. That small pupil means they don't really get into these hotspot areas. And so their steep axis is really here, not there. So even though the doctor was quite convinced the lens should be sitting at 43, it wasn't. They were able to use the iTrace to say post-op, the steep axis in this patient's small pupil is really 26, not 43, or in this case 47, where the lens sits. So when you think about these toric surprises, sometimes our equipment lets us down. A simulated keratometry is never as good as refractive case, and even better are what's found in the iTrace wavefront case. They're a big area, and they give you a more precise location. So when you have a toric surprise, don't be afraid to try to work backwards and figure out what went wrong, and was it the equipment? Was it your algorithm? Was it the calculation that you used? There are ways to get better, and in this case, it's pretty easy. Rotate 18 degrees, get a great result, patient's excited. Thanks. Appreciate you listening to today's iTrace University Toric Complications.